Welcome, Lou and Alex, two of the practitioners. So Lou from Link Health and Community and Alex from Carrington Health. And they're going to present one of the case studies which I just briefly mentioned earlier, which is included in the framework and has been developed in parallel with the conversations in the development of the framework, as the organisations are key partners in the Integrated Health Promotion Partnership. So I'll hand over to you two now, and thank you for being part of it.
Thanks, Sue. I'll just
Thanks so much, Sue.
Our presentation. Hopefully that's appeared.
Well, thanks for the opportunity to share part of our story. In 2017, our 3 community health services, Access in Boroondara, Link in Monash, and Carrington Health in Whitehorse, got agreement from DHHS to partner together on a shared priority of social inclusion. The IEPCP is the backbone organisation of the partnership, providing admin support, resources and training. We have developed and submitted joint health promotion plans to the department during the 4-year period through to 2021. As each community health service was already working with social housing communities in their particular municipalities, we included an objective in the plan with shared actions in the social housing setting. And as well described previously by Tracy in her introduction and by Patricia, our definition and understanding of social inclusion has been guided by the report produced in 2016 by Deakin Uni for MSIC, a definition that they had adopted from the Australian Social Inclusion Board, and that is having the resources, opportunities and capabilities to learn, work, engage and have a voice. Amongst its findings, the report linked social inclusion to the livability of the neighbourhood. The report noted that livability refers to the degree to which communities are safe, attractive, environmentally stable, socially cohesive and socially inclusive. We chose several livability domains to use in analysing the livability of these social housing areas. These domains included employment, the food environment, especially those shops within walking distance of the estate, such as the milk bar pictured here, housing, public open space such as parks, playgrounds and sports fields, public transport, walkability of the area, and social infrastructure, including local services, leisure and cultural opportunities. Indicators of social exclusion include low neighbourhood quality, low satisfaction with the neighbourhood, infrequent social activity, and feeling unsafe, highlighting possible areas for change.
So we wanted to engage with social housing communities in order to better understand their experiences of the livability of their neighbourhoods and to understand how that influenced their resources, opportunities and capabilities to work, learn, engage and have a voice. So health promotion practitioners from each of the 3 community health services mentioned came together to form a working group, and we developed a shared methodology for consultation across 3 social housing communities in Ashburton, in the city of Boroondara, Ashford Chadstone in the city of Monash, and Waddle Hill, Burwood in the city of Whitehorse. This process was supported by IEPCP and by Bernie Murphy from Deakin Uni. And partway through the process, another housing estate in Hawthorne East, also in Boroondara, was added to the project. So the purpose of the engagement strategy was to provide each community the opportunity to understand the links between livability and social inclusion, and to be empowered to influence the improvement of the livability of their neighbourhoods. And our objectives included to engage a diverse range of voices from these communities using methodologies appropriate for each community, to engage a diversity of other key informants. So for us, that was local government, community agencies, schools, different local movers and shakers, and to identify opportunities for action in collaboration with communities. So our hope was that the consultation process itself and the actions arising would promote social inclusion by creating opportunities for residents to have an influence in decisions that would affect them, or giving them the opportunity to have a voice. So each of the practitioners had an existing relationship with the communities that we were working with. So this meant that we were able to design methodologies that were appropriate to engage with each community. We engaged with residents and stakeholders through face-to-face interviews, written surveys, and focus groups in a variety of different settings, locations, and times. We asked questions to try and understand what people felt the strengths of their neighbourhoods were and what some of the challenges were to living there. And then we sought ideas and suggestions for improvements people would like to see, or changes that could improve livability of where they lived. And once we had analysed that initial data, we undertook some follow-up engagement to understand the community's priorities out of all of the different issues and ideas that had been raised.
Several common themes affecting livability were identified across the 4 social housing areas. One issue was with graffiti or unattractive streetscapes. For example, hard rubbish left out on nature strips for long periods of time makes people feel unsafe in their community and contributes to stigma. They mentioned issues with traffic and parking, such as residents unable to safely move around their community on foot. Poor connection to local services, which can be for reasons such as hard to physically access, lack of knowledge of service system, financial barriers to services, or feeling excluded. Public transport's not accessible for all. An example here is the lack of low-floor trams on some routes, which excludes people with compromised mobility or those with a pram. Issues with housing and antisocial behaviour also came up, such as housing being too small for the number of tenants. And one of the families told me that there were 4 of them in a 2-bedroom house and they were using the carport as a storage space. And digital exclusion is a big one. While many of us have access to multiple digital devices, some residents just have a phone and often run out of phone credit for calls or data. A young mum, a single parent, told me she uses free Wi-Fi in the Box Hill food court and uses computers in public libraries to search for jobs, etc. Of course, there was no access to these spaces during the many months of lockdown. We've developed rich pictures for both the Ashford, Chadstone and Waddle Hill areas. We use them to visually represent the findings, including the geography and infrastructure of each local area and what the residents told us about living there, linking their thoughts to the various livability domains. We've used the rich pictures as a tool for further engagement with the community, as well as advocacy with stakeholders. Here are a couple of examples of actions addressing barriers to inclusion. Firstly, Waddle Park, which is next door to the Waddle Hill housing estate. The Waddle Hill residents identified the park as really important to their well-being, but reported issues that made it difficult or unsafe to walk there and made it hard to use it for social connection. During the COVID lockdown period, Parks Victoria commenced a community consultation on a $4.3 million upgrade of the park. Carrington Health has been able to build a relationship with Parks Victoria and worked with them to ensure Waddle Hill residents' views and ideas were heard as part of the consultation. We will do the same with further phases of consultation in 2021. Secondly, the Ashford Chadstone consultation highlighted a high level of community concern about pedestrian access over a busy road in Ashwood and a strong desire for this to be addressed. These findings were communicated to Monash Council through various avenues and the concern was acknowledged by them. We were pleased to learn that pedestrian crossing has been included at the intersection in recently updated plans for development in this area. Back to you, Lou.
Thanks, Alex. One issue that was common across all the communities was the need for improved digital inclusion. COVID-19 has, amongst other things this year, reinforced the critical importance of people being digitally included, and it's exacerbated existing inequalities in this space. So our 3 community health services, along with Inner East PCP, are working together to build partnerships and explore opportunities to address the norms, structures and practices that have compromised digital inclusion for people living in social housing. And when we talk about digital inclusion, there are 3 pillars that we look to address, which are around access, affordability, and people's individual digital capability. So far, we have had some initial scoping meetings with the network of Inner East community houses to learn about their Be Connected digital mentoring program, and to consider how we might support providers of this program to engage with social housing communities and make sure that the program's reaching people who are most at risk of exclusion. And we're also exploring some advocacy efforts to which we can add our voices and the voices of our communities to be addressing some of those broader issues around infrastructure, access and affordability. As Sue mentioned, because the framework was developed by the PCP in parallel to this work, it wasn't available for us to use as a guiding document. However, some of our experiences and learnings from this engagement piece have informed elements of the framework, and our engagement methodology has demonstrated the principles embedded in the framework. So, for example, using the socio-ecological model of health as a way of understanding social inclusion, a commitment to addressing the norms, structures and practices that privilege some groups over others, and the importance of working in partnership. So thanks so much. We've been Alex and Louisa from Carrington Health and Link Health and Community, and we'd like to acknowledge our colleagues at Access Health and Community, Owen Peach, Angela Vidic and Heather Cole. Thanks everyone for coming along today. Thanks Patricia, it was so wonderful to hear you speak and to understand a little bit more about the history and the context of what's occurred and paved the way for some of this work that we're doing now. And huge thanks to Inner East PCP for their support of all of this work and for the opportunity to come along today and share a little bit of what we've been doing.